to have them lay supine on the table. Lay down your back here. And in the clinical setting, you would ask the patient if they had anything metal around the area of interest, or if they had thick jeans on, to move them down and cover them up. Next thing you want to do is make sure that your CR is 40 inches SID, and if you have a fancy machine like this, all you have to do is just press automatic on, and it will adjust itself. After you have the patient laying on the table, you want to make sure that he's centered to the CR, and you want to make sure that he has his hands either on his chest or down by his side. When you're positioning for the APL spine, what you want to do is center the IR to the mid-sagittal plane, and the place where you want to center it is 3 fingers above the iliac crest. Place 3 fingers right there, bring it up, open your collimation, collimate in, make sure that your central ray is aligned to your bucky, and after you have the patient in the proper position, place your marker on the appropriate side. And also for this, you would want to use a 14 by 17 portrait cassette. After you have that entered, make sure that your positioning and collimation is correct. Make sure there's no artifacts in the way. And then, for breathing instructions, you would have the patient take in a deep breath and blow it out and hold it. And then you would shoot the exposure. And that rolling. The next procedure in the sequence is going to be a lateral L spine. And for the lateral L spine, of course, since you've already done the AP, you'd already have all artifacts out of the way, all metal objects. Your SID is still 40 inches. You would use a 14 by 17 portrait cassette. And for this one, you need the patient to roll up on their left side. You're opening those up for me. You want to make sure that the shoulders are perfectly lateral. Bring the shoulder towards me just a little bit. You can also have them bend their knees for support, put their arms up by their head here. And after you make sure that their back is perfectly lateral, the centering to the central ray is the same as the AP. You find the patient's iliac crest, place 3 fingers above it, be 1.5 inches. You'd move the central ray to the 3.5 fingers. Then you would move the patient and center along his, not exactly his mid-coronal plane, you just want to make sure you get the spine without too much other body parts in the way. And once you've lined up to the patient, you just want to collimate down, make sure that a little light skims off the back. And you may want to leave a little bit of light to place a marker, or you can place the marker any other place that is not in the field of the spine. I'm going to leave the collimation open just a little bit more than I normally would, just for visualization purposes. And after you make sure that the patient is lined up, centered in the correct spot, and your collimation is down, you can place your marker anywhere you like that's not in the field of view. You want to place it right here in the light, away from his body, to make sure it doesn't show up in anything that needs to be seen. And after you check the centering one last time, make sure the collimation is good, you would give the patient breathing instructions of take a deep breath in and blow it out and hold it. Then you would take your exposure. And that is how you do a lateral L spine. The next procedure in the sequence is the L5S1 spot. And for this one, you want to make sure you use a 10 by 12 or smaller cassette. you want to make sure your bucky is lined up, as you did for the last one. And for this one, the way I like to do is place your finger on the top of the iliac crest. And this can vary depending on your hand size or anything. Whatever you find that works for you is the best method to use. I usually like to bring my thumb down along the side of the pelvis, and then actually I angle my tube caudally until I'm around the knuckle of my pointer finger. Right there should be good. And always when you angle your bucky, when you angle your tube, you want to make sure that your bucky is lined up where you move it. And after you have it lined up and you have it centered in the correct spot, you can always collimate in and make sure to place a marker on the side that is down, just like on the lateral. You place your marker in an area where you think it will be out of the way. And after you have it centered for the spot, and also, the angulization usually ends up around between 5 to 8 degrees. And I usually use angulization just to open up the joint space. And after you have it angled and centered at the correct spot, proper collimation and your marker in place, you want to tell your patient to take in a deep breath, blow it out, and hold it, and take the exposure. And that is how you do the L5-S1 spot.